It's a new virus that's emerged to infect humans from a group of viruses that we know. So there are types of coronaviruses that cause a common cold, which have been around since the 1960s. And then there are some more recently emerged severe coronavirus infections like SARS in 2003 and MERS coronavirus in 2012, and then this new virus that emerged late last year in Wuhan, China. So there's multiple groups working on vaccines currently for this virus through an organisation called Coalition for Epidemic Preparedness Initiatives, which is funded by both pharmaceutical industry and agencies like the Gates Foundation. So they have funded people around the world, including in the US, in Australia as well, to work on vaccines. There was a lot of work done on a MERS coronavirus vaccine. So that probably gives people a bit of a head start because it's a similar virus. There's a lot of things we can do, which we already are doing, that are non-pharmaceutical interventions, such as social distancing, quarantine, travel bans, and they do work. That's, we've shown that through our modelling work in the past for other diseases, they work. And if we don't try our damnedest to control it now, then, you could be looking at increased sickness and death in communities around the world. And the other reason to try to stop it coming into countries or contain it is that if you can delay sustained community transmission in your country, then there might be a vaccine available. So if it doesn't come into, say, to Australia and spread widely in the community until the middle of the year, we might actually be much closer to a vaccine, which then again reduces the deaths and illness. Some of the epidemiologic work will help understand the transmission better. There's still, despite the certainty in some people's proclamations about knowing how it spreads, we actually don't know as much as we know about other diseases. It's a new disease. It's not as well studied. Every new publication that comes out gives us more insights, more information. So I think understanding the transmission better will help us with the disease control strategies and also with projecting how it's going to behave in the future. I'd have to say some of the modelling work that's been done to date has used the available public data, which is data on date of reporting of cases, which is not necessarily accurate data because the date that things get reported are not always the date that people became sick. A lot of uncertainty in the estimates and projections that are being made. Well, we've certainly done work in the Plus Alliance around avian influenza. We've also done some work with Matthew Scotch at ASU on MERS coronavirus. And that's looking at genetic sequence data and trying to analyse the epidemiologic patterns and understand the risk factors better. So avian flu and MERS coronavirus, but I think it would be a good opportunity to also study this new virus. Some of the work that we're doing is around rapid epidemic intelligence, and there's been a question about countries like Indonesia, for example, the African continent as well, about the surveillance systems for disease not being as good as other parts of the world. So perhaps that's why we're not seeing cases. Maybe there are cases there, but we haven't detected them. So we are have been working on for the past 5 years, a rapid epidemic intelligence system which bypasses the need for human resources and also bypasses censorship of information, which may occur in some instances where there is fear of loss of tourism or trade or other critical factors to economies. And you may recall the suspected Ebola outbreak in Tanzania last year. I think there was a feeling that there was a fear about the impact on tourism and trade on the economy there, and a reluctance to really report what was going on. So what you're doing basically is tapping into open source data, which includes social media, news feeds, because often these things get reported well before health authorities become alerted to them. Either people are talking about them on social media, or there's local news reports saying people are dying, people are in the hospital. So we have developed a system called EpiWatch, which can pick up these early signals and analyze them, and that's got a lot of utility in terms of looking at low resource settings where the surveillance data may not be as good. If you can see that there's lots of reports of pneumonia coming out of a particular country where you don't have official surveillance data. We have developed language searching capability, and we have actually added on Bahasa Indonesia and Bahasa Melayu for Malay, but we haven't looked at it yet, but it is something we will do.